Good morning. This is Dr. Timothy Scott Beck here at Life Point Medical. It's Monday morning, October the 25th of 2021, and everything's up and running as scheduled this morning, which is a wonderful thing. I'm blessed to be here, and I'm blessed to have another day, and we're blessed with this beautiful weather we've been having. So let's talk about COVID for a second. 2,087 listed cases today with 54 deaths, which is up one from last week. So it's still around, it's still beating on us a little bit, and we've already had a few calls this morning from people who think they have the COVID or whatever. So I just want you to be aware. Again, if you're in the high-risk group and you haven't had the vaccination and you want to talk to your doctor about it, being me or one of our team members, we were more than happy to discuss it with you, okay? Because I really think that is a very good thing I can offer you. I can give you perspective, and I can give you a very detailed description of why I think you would or should not have it at this point. And I think a lot of people are missing that, and they're trying to collect data on their own, which is fine, and I'm not against that. It's just you got to have somebody to help you mediate the good and the bad and all this other stuff. The other thing I want to talk to you about, this is just a thing we do. So here at the office, we have a way we do business. Okay, so here's the way our business works so you can understand this, and I think it's going to help you out if you can understand this. We schedule patients every day from 8 o'clock in the morning through 4 o'clock or 3 o'clock in the afternoon. And we leave the 4 o'clock work-in slot open so that if you call or anybody calls on that day, we can see you at 4 o'clock. And the schedulers, which I have 4 of them answering the phone, is not allowed to put anybody on the schedule at 4 o'clock until the day of. Okay, and that keeps it open, and that keeps it so we can get people and we can take care of people that need to. And what it is we stay and we do all we've got to do till everybody who needs to be seen is being seen. Now, one of the complications that we are finding, and I want to talk to you about this, is walk-ins. So we've had it in the past where we can handle walk-ins, but we can't handle walk-ins no more. Like just people coming off the street and saying, I needed help. We can't do that anymore because our schedule is booked out, and we book it so that we stay busy most of the time during the day, except for that 4 o'clock slot. So I just want to ask you kindly, so that you don't get disappointed, that we don't do walk-ins. If you can walk in and ask us when you can be seen, or as a way to communicate with us, but I don't want you to walk into the office thinking that you're going to be accommodated right then, okay? Because we're not set up that way. We have a very robust schedule that we have to go by. And putting in a patient who walks in, particularly if they're really sick, is almost impossible for us to do. So please just be mindful of that. Sometimes people come in and they're on the nurse's schedule to have a service done to them, whether it's draw blood or have a shot done or some kind of evaluation by a nurse. Those are also times where a provider typically can't see you because we're booked up, and we do the nurse's schedule as a separate schedule. And I'm not talking about our nurse practitioners, I'm talking about the actual nurses, and when you're doing something where a provider is not mandatory to be involved. So if you're in here for that, sometimes people will say, well, I actually want to see the provider today too, since I'm here. And we have to disappoint them because we can't bump somebody who's been on the schedule for 3 months because you're asking to be seen that day. So, but you can ask, hey, when's the next time I can be seen, or when I can come in here and be taken care of by a provider, and we will accommodate you and we'll try to find you. And if it's something urgent, we'll put you in that work-in slot that afternoon. Okay, so that's how we do it. I just don't want, I hear some people get really disappointed when they come here and they want to be seen and they can't be seen exactly right when they want to. We recognize that there's urgent needs, and that's why we have the 4 o'clock spot. If that 4 o'clock spot can't accommodate you, then that's when we have to send you to the emergency room. Plus, if you do walk in and you have a problem that is beyond our capability, we have to send you to the ER anyway. And there is times, like for instance, somebody has chest pain. When they come into the office and they're having active chest pain or something like that, we invariably have to send you to the emergency room, mainly because we can't do enough here in the time frame that's needed to make sure you're safe. Okay, like you got to have labs and EKGs and X-rays and sometimes CT scans to make sure you're okay with those chest pains. We can't do all of those here, and we have to send you someplace where they can do it all right then and get it taken care of, and that's the emergency room. We do like to help people when they go to the emergency room by giving the emergency room heads up so that they know you're coming, but for the most part, we have to send you to the emergency room. All righty, this is Dr. Timothy Scott Beck. I hope I've cleared some things up for you so you can make it easier in interacting with us. You have a wonderful day and call us if you need us. Thank you.